For decades, we've all been told to watch one number for our heart health, cholesterol, right? It's like the main headline. But what if that headline is actually missing the real story? What if the most important details are kind of hidden in the fine print?
So picture this, you get your lab results back and the news seems fantastic. Your total cholesterol is right in the healthy range. Phew, it's this huge moment of relief. But could that number be giving you a false sense of security? That's the really critical question we need to start asking.
So let's dive into what you might call the cholesterol myth. For years, the story's been pretty simple. Lower is always better. But, a much more nuanced picture is starting to emerge, and it shows why we might be focusing way too narrowly on just one single piece of the puzzle. And let's be clear, this wasn't wrong. For a long time, the standard test was an absolutely essential tool. It gave us a simple, accessible way to even start a conversation about heart disease risk, and it became the benchmark that everybody knew to ask their doctor about. But as our understanding of all this evolves, there's a warning from doctors that's getting louder and louder. And the message is pretty straightforward. To really understand our risk, we've got to look at a much bigger picture than just that one familiar number. So here's the bottom line. A good cholesterol score is still a great thing, don't get me wrong, but it doesn't automatically mean you have a perfectly clean bill of health. It's a piece of the puzzle, for sure, but it is not the whole puzzle itself.
Exactly, right? If the main character in our story isn't telling us everything, then we need to meet the rest of the cast. What are the other vital signs and markers that can give us that truly complete view of our cardiovascular risk?
And that's where these advanced markers come in. We're now getting into the world of more cutting-edge diagnostics, tests that can give us brand new clues by looking just a little bit deeper than that standard panel. Now, these might not be household names just yet, but trust me, they are incredibly powerful for understanding what is actually happening inside your arteries. Okay, this is a huge shift in thinking. Instead of just measuring the total amount of cholesterol, ApoB actually counts the number of particles that are carrying it. Think of it like this. It's not the total volume of traffic on a highway that matters most, but the number of individual cars that could cause a traffic jam. More particles means more chances for one of them to get into the artery wall and start forming dangerous plaque. That's why the particle counts can be a much more direct measure of your risk. And this one, LPA, is fascinating because it's mostly determined by your genes. You could have a perfect diet, an amazing exercise routine, but if you have a high LPA, you could still be at a higher risk. Knowing this number is so important because it's a risk factor that lifestyle changes alone might not really move the needle on. This really puts it all into perspective, doesn't it? The standard view is kind of like looking at a city from a distance. You can see the skyline, sure, but not what's happening on the streets. The advanced view, that's like having a detailed map. By adding ApoB and LPA to the mix, you're giving your doctor a much, much clearer picture of your actual personal risk. Okay, but the story doesn't even end with advanced lab tests. Some of the most powerful data doesn't require a needle at all. Seriously, your body is giving you clues every single day, and these are metrics you can actually track yourself. So what are we talking about here? What can you track without a trip to the lab? Well, your overall fitness is a gigantic part of your heart health, and there are now some really great, accessible ways to measure it. Two key metrics really stand out here. First, your resting heart rate. It's simple, but it's a super powerful indicator of how efficient your heart is. And second, your VO2 max. A lot of wearables can estimate this for you now, and it's basically the gold standard for your cardiorespiratory fitness. It measures how well your body uses oxygen when you exercise. And get this, a higher VO2 max is one of the strongest predictors of long-term health and just how long you're going to live. So this all brings us to the final and maybe the most important part, putting it all together. How do we take all these different data points, the old, the new, and the ones we track ourselves, and combine them into one single coherent health picture? This right here is your takeaway. This is how you can be proactive. First, start with the basics you already know. Then, open the door to a deeper conversation by asking your doctor specifically about ApoB and LPA. And finally, bring your own data to the table. Talk about your fitness, your resting heart rate. Suddenly, you're not just a passive patient. You're an informed partner in your own health. And that's really the ultimate question, isn't it? A standard checkup is a great start, but in this age of personalized medicine, it's worth asking if your personal health picture is as complete and as detailed as it could be. Because the more you know, the more power you have to protect your health for the long run.